Now, given the way things are with insurance and everything else, and particularly in the United States, we do have to find a doctor versus it just being this was my mama's and daddy's doctor, so now it's my doctor. Now we have to go find one. So we've got this list in the network, and we're like, okay, I got to pick a doctor. How do we go about making sure that this doctor is the right doctor for us?
Right. There are some basic things you can do just to, do a little research. Most doctors have websites. You can get a sense of, at least where this doctor went to school, whether or not they're board certified. There are websites that I give in the reference section that just says, let me just do a little due diligence. This doctor have, lawsuits pending? Has this doctor had, various and sundry other issues that have been reported because we are required to report those to a central database. So that's just your basic fact finding. Now, because a doctor went to Harvard, does that make them great? No, not necessarily. Might mean they're pretty smart, but how a doctor actually interacts with you, whether or not they hear you, they see you, these are important points in terms of what your relationship is going to be. So I say, yeah, crowdsource it. Talk to your friends, talk to people who may or may not have seen this physician. They'll usually give you some good feedback. I always caution when people are looking at online ratings for doctors because I say, well, sometimes they're helpful, sometimes they're not. But I assure you that people who have had great experiences may take the time to fill out an online survey. Patients who've had terrible experiences for whatever reason that may not have had anything to do with you, they're going to be the ones who are most motivated to go on an online rating system. So you have to take all of that with a grain of salt and really know that there are a lot of ways and I'm sure you know this, in online ratings to really juke the stats.
Yeah,
So I would say, okay, look at a few comments if you must, but this is a doctor's visit. It's not a restaurant. It's not Yelp.
yeah.
So,
This is an
take those,
Amazon.
yeah, take it for what it's worth. But I think the most important interaction that you're going to have when you're really trying to choose a doctor is to call the doctor's office. And you can usually speak to an administrator or someone and just ask some very basic questions. What's the average wait time for this doctor? It may be that you don't mind because you're seeing the doctor once a year, but if you have something that's going to require ongoing care, I need to know that the wait is not 6 months. I need to have basic answers like, well, if I have an emergency or I need an appointment for something that's not routine, how is that handled? I mean, the basic logistics of the office, you don't need to go in and have and pay for a doctor's visit to get those questions answered, but someone in that office should be able to. So you at least get the lay of the land. And I say, I always say, don't let the perfect get in the way of the good. You want to have a good, competent doctor who's convenient, who's within your insurance plan, who knows how to handle the basic things that you need to have done. And most people are not seeing doctors in extremis in the beginning. That's sort of where you start and you establish a relationship. And that's your opportunity to then, when you have an in-person visit, to trust your gut. You know, did this patient doctor interaction seem rushed? Were they harried? Were they typing when I was talking? I mean, these are all, trust your gut moments. So all of that really has to go into that interaction about how to pick a doctor. And here's the other thing. Don't be afraid if this one isn't working for you, go find another one. There's usually someone else. There are other people to choose from. So don't stick with something because, you know,